When we evaluate a patient for an acute myeloid leukemia diagnosis, a bone marrow biopsy and aspirin is done, and at that time, as we talked about, the molecular testing was sent. There are some institutions that will send that from the peripheral blood, but at the time of diagnosis, we typically will send off that molecular panel or next generation sequencing panel from the bone marrow aspirate sample. These types of tests are kind of various. They're varied in nature. So at our institution, we have an in-house panel that allows us to test for up to 60 or even 100 genes at one time. At other institutions, they may not have the in-house capability of doing that and need to send out to other sites. Furthermore, even with the IDH2 mutation, there's a real-time assay that you can send off that specifically only tests for that particular mutation. By and large, many institutions are using lots of panel-based next-generation sequencing testing formats because you can get lots of information, often for that's more cost-effective. Many of these tests can be Foundation One, ARUP. Other institutions like Novartis also has panels, but other institutions often have panels as well, so it can be that institutions work together to process samples. The turnaround time for this type of testing can be up to 2 weeks. For some locations, it can be longer just by the very nature of when you get the sample and when it actually arrives to the place to be tested. But by and large, next-generation sequencing is now a standard of care for all of our patients with acute leukemia at the time of a new diagnosis. In addition, comprehensive cytogenetics is also a very important test for many of our patients with the diagnosis of AML, and we like to make sure that 20 cells are actually growing when comprehensive cytogenetics are done. Some institutions at the same time also do FISH testing for AML to make sure that good risk or core binding factor leukemias are ruled out or ruled in for patients that in terms of moving forward with therapy, and not only in their short-term treatment, but even in their long-term treatments.